Good afternoon, everyone. My title for the Journal Club presentation is Treatment with Psychostimulants and Atomoxetine in People with Psychotic Disorders, Reassessing the Risk of Clinical Deterioration in a Real-World Setting. The principal author of this article is Olivier Courbet, and others are Sebastien Brodeur, Josiane Porteau, Laurent Bouchard, Maxime Hotlevy, among others. The publication was in the British Journal of Psychiatry. The publication date is of 4th December 2023. Now, the type of article, this is an original article. For the financial support and sponsorship, this study was supported by a grant from Janssen, which is a division of Johnson & Johnson, and the Minister de l'Economie et de l'Innovation. Now, the declaration of interest, which was of this article, is that the chief author, Olivier Courbet, he is currently receiving a fellowship award from the Canadian Institutes of Health Sciences. LB is currently receiving a doctoral training scholarship from the Fonds de Recherche du Québec Santé. ES has received unrestricted grants from Lundbeck Canada Incorporated and Otsuka Canada Pharmaceutical Incorporated, and has served on advisory boards and been a lecturer for Lundbeck Canada Incorporated, Otsuka Canada Pharmaceutical Incorporated, and Janssen. MFD has received consulting fees from AbbVie and has served on advisory boards and been a lecturer for AbbVie and Otsuka Lundbeck Alliance Canada. The date of approval of this article is 17th October 2023. Now, we will mention about the British Journal of Psychiatry. Now, this is a leading international peer-reviewed journal covering all branches of psychiatry with a particular emphasis on the clinical aspects of each topic. This journal is published monthly on behalf of the Royal College of Psychiatrists. This journal is committed to improving the prevention, investigation, diagnosis, treatment, and care of mental illness, as well as the promotion of mental health globally. The editor-in-chief is Professor Gin Valley. The impact factor in 2022 was 10.5, and the 5-year impact factor of this journal is 11.1. Now, introduction. Attention Deficit Hyperactivity Disorder, or ADHD, it is one of the most common psychiatric disorders among children, with an estimated prevalence of 2.2 to 7.2%, and it persists into adulthood in over 50% of people. Now, there is also evidence that children and adolescents with ADHD, they have more than 4-fold increased risk of schizophrenia spectrum and other psychotic disorders in adulthood compared with the general population. Now, among adolescents and young adults at clinical high risk for schizophrenia spectrum and other psychotic disorders, a childhood diagnosis of ADHD also appears to predict conversion to schizophrenia spectrum and other psychotic disorders. And the prevalence of ADHD in individuals with schizophrenia spectrum and other psychotic disorders is higher than that observed in the general population, with estimates ranging from 10 to 47%. Now, psychostimulants, which are used in the treatment of ADHD, they increase the synaptic availability of dopamine and noradrenaline, primarily by inhibiting the presynaptic reuptake, which appears to be an opposite effect to the postsynaptic blockage of dopamine D2 receptors, which is achieved with antipsychotics. And in addition, there are cases of psychotic events. The cases of psychotic events, they have been linked to the use of psychostimulants in individuals without a history of psychosis. Now, the aim of the study was to examine whether the risk of hospital admission for psychosis in people with schizophrenia spectrum and other psychotic diseases was increased during the year following the introduction of ADHD medications compared with the year before. Now, the need for study. Now, the available evidence suggests that ADHD is associated with a worse course of schizophrenia spectrum and other psychotic disorders, including earlier onset, lower academic, social, and occupational functioning, as well as a poorer response to treatment. Therefore, appropriate treatment of comorbid ADHD with psychostimulants, including amphetamines and methylphenidate or atomoxetine, it may promote recovery. But as we mentioned before, that there is There is fear of increased risk of psychosis, hence there is reluctance to use them in daily clinical practice. Now the materials and methods. Now this was a retrospective cohort study using the Quebec, Canada Administrative Health Registries, including all Quebec residents with a public prescription drug insurance plan and a diagnosis of psychotic disorders, defined by relevant ICD-9 or ICD-10 codes, who initiated either methylphenidate, amphetamines, or atomoxetine between January 2010 and December 2016 in combination with antipsychotic medication. Now, the primary dependent variable, it is the time until a hospital admission for psychosis, which included your ICD according to ICD-10, F20 to F29, 1 year after psychostimulant or atomoxetine initiation. And the secondary dependent variables are the time until hospital admission for mental disorders other than psychosis and time until hospital admission for any mental disorders, either psychotic disorder or non-psychotic disorder. Along with this, stage sequence analysis was also used to visualize admission trajectories for psychosis in the year following initiation of these medications compared with the previous year. Along with this, the following four variables were also assessed because they may potentially influence treatment adherence and hospital admission trajectories. The sex at birth, if the patient is a male or female, the age at psychostimulant or atomoxetine initiation, no socioeconomic status, which was defined as being a recipient of social welfare or being more than 65 years of age with pension income supplement. The psychosis duration, if it was less than 2 years, 2 to 5 years, 5 to 10 years, or more than 10 years. The initial prescriber of psychostimulant or atomoxetine, if either it was a psychiatrist or it were any other clinicians. The prescriber of antipsychotic near the index date of the study, either if it was either psychiatrist or other clinicians. If the patient had any substance use disorder during the 12-month period prior to psychostimulant or atomoxetine initiation, any personality disorder diagnosis, if there were any use of lithium, Devalproex, antidepressants, benzodiazepines, or lamotrigine, any hospital admission for psychosis for a mental disorder other than psychosis, for any mental disorder, either psychotic or non-psychotic disorder, or for a physical health reason, the number of ambulatory visits, which included your emergency, outpatient, and primary care clinics, and the comorbidity index. Now, the statistical analysis, the psychostimulant or atomoxetine utilization trajectories, they were illustrated using a stage sequence analysis approach. Antipsychotic utilization trajectories before and after ADHD medication initiation, as well as hospital admission trajectories, are also presented using the stage sequence analysis method. Along with this, Fox regression modeling was used with time-dependent psychostimulant or atomoxetine and antipsychotic drug variables, including in the models of all the above covariates identified as potentially confounding using the directed acyclic graph approach. A post-hoc analysis was also conducted to examine whether individuals who initiated a psychostimulant or atomoxetine were comparable to the population of individuals with schizophrenia spectrum and other psychotic disorders without ADHD medication use. Now, this table, it shows that here, these are the patients which were diagnosed with severe mental disorder between January 2002 and December 2017 in Quebec, Canada. Then we chose the patients which were around 380,124. Then we chose the patient, out of these, we chose the patients who were diagnosed with psychosis between January 2022 and December 2017, which came out to be 235,027. Then we chose from these, we chose the patients with at least one claim of ADHD medication between January 2002 and December 2017, which came out to be 11,391. Then from our index date, between January 2010 and December 2016, we chose those patients which initiated ADHD medication during that date. Then from these, we chose the patients in the public prescription drug insurance plan, which 1 year before and 1 year after the index date, which came out to be 4,431. From these, we chose the patients with a prior diagnosis of psychosis between 2002 and index date, and we excluded those patients who did not have a prior diagnosis of psychosis between 2002 and the index date. Then, from these 3,333 patients, we chose the patients with at least one antipsychotic claim within plus minus 30 days of the index date, and we excluded the others. Then, from these, we excluded those patients who initiated more than one ADHD medication, and we finally came to a final study cohort, which was 2,290. To 2017. Sir, this was that. No, sir, they did not mention anything about that. Yes. So the tables which we chose for psychosis, so they said that the period it should be less than 2 years, 2 to 5 years, and so then it was to 8 years. So, sir, and so we excluded all of those patients who had a prior history, who did not have a prior diagnosis of psychosis, matlab, who had a diagnosis of psychosis before 2020. So that was our cis. Um, Between 2000, sir, any patients? Yes, sir. So, the results, there were 235,027 patients who were diagnosed with schizophrenia spectrum and other psychotic disorders between January 2002 and December 2017, of whom 11,391, that is 4.8% of these patients, they used an ADHD medication during this period. The final study population consisted of 2,219 patients who initiated these medications between 1st January 2010 and 31st December 2016. Out of these, there were 1,589 patients who initiated methylphenidate, 339 patients were prescribed amphetamines, and 291 were prescribed atomoxetine. Now, these results, they show that the results, they were predominantly more males were included in the study cohort. The mean age was around 37 years of age, and the amount of and the ADHD medications usually matlab, they were usually prescribed by a psychiatrist rather than rather than a general practitioner. And in the same way, the antipsychotic prescription was also given by a psychiatrist. Now, this figure, it shows the state distribution plots of attention deficit hyperactivity disorder medication used 1 year after its initiation date. So as we can see that in ADHD, uh, in all of them, in methylphenidate, amphetamines, or atomoxetine, around 1 year after the index date, the there was initial some continuous use, and then there was a decrease in the medication adherence over the following year. Then in the antipsychotic utilization trajectory, we can say that this is our index date where the ADHD medication was started. So in these we can see that there is, and this is before 1 year. So before 1 year it is usually continuous, and there is an early spike which is followed at the index date. Which shows that there was more adherence to medications after the initiation of ADHD medications. Then our third graph, it shows the hospital admission. So here we can see that from the index date in both of the three medications, there is a decrease in the admission rates after the initiation of ADHD medications. Now, this is our third table, this is the Cox regression model, and this has confirmed the statistical significance of these observations. So here there were adjustments which were made for the gender, for the age, for the duration of the psychosis, and for the antipsychotic prescriber, for the socio-economic status. And all of these, they showed that there was a lower risk of admission for psychosis in those individuals which received a combination of antipsychotic and psychostimulant or atomoxetine in the year after its initiation. Sir, तो दिस टेबल सर इनका इसका जो समरी था सर इसमें ये लिखा हुआ था कि सर इसका जो एनालिसिस हुआ था उसके बाद दे फाउंड दैट आफ्टर ऑल ऑफ दीज फैक्टर्स दोस पेशेंट्स जिनका एडीएचडी मेडिकेशन साथ में यूज हुआ था सो देयर वाज अ लोअर रिस्क फॉर हॉस्पिटल एडमिशन और साइकोसिस. Not only this, that the combination of say psychostimulants and so antipsychotic medication both they were associated with a decreased risk of emotion. So these squares which are on the left, if they are on the left, it means that they are not statistically significant. And if the squares they are on the right, it means- yes, sir. Sir, in this, the ADHD reaction and antipsychotics, so the p-value, if it is less than 0.001, so that means that the result is statistically significant. Hmm. Yes, sir. सर यहाँ पे नहीं मेंशन करा है सर ऐसे सर normal studies or if the p-value is less than 0.001 is considered. तो मोर देन 0.005 से उससे ज्यादा हो जाता है तो इसका स्टेटिस्टिकली सिग्निफिकेंट हो जाता है से लेस देन 0.001 इससे कि
उन्होंने बस इससे यही कंक्लूड किया ना कि अगर आप एडीएचडी मेडिसिन साथ में यूज कर रहे हो तो हॉस्पिटल एडमिशन के रिस्क ज्यादा नहीं बढ़ रहे, ठीक है। इस तो इसमें दिखाओ ना, दिख तो रहा है। वो चीजें हैं। ये तो भी रिपोर्ट सिग्नेचर ले जाओ कि ऐसा वो एनालिसिस होता है, यूजुअली मेटा बेसिस में होता है। अगर इसका जो स्क्वायर बॉक्स है वो बन के मतलब इसमें एक फाइनल फैक्टर लेते हैं कि हमारा फाइनल टारगेट क्या है और वो बाकी फैक्टर से इन्फ्लुएंस हो रहेगा। फाइनल टारगेट है इसमें आपका हॉस्पिटल एडमिशन। हॉस्पिटल एडमिशन साइकोलॉजी में हो रहा नहीं, जो ऊपर लिखा हुआ है या 2 घंटे के ऊपर लिखा हुआ है। तो वो हम लेके हमारा टारगेट ये बाकी जो इधर फैक्टर्स हैं वो फाइनल टारगेट को इन्फ्लुएंस कर रहे नहीं करते। अगर आपका स्क्वायर वन से दूसरी मैट्रिक्स में यूज करते हैं तो 5 6 इकट्ठी करके हम लोग कुछ रिजल्ट निकालते हैं। अगर वो वन के राइट साइड में स्क्वायर तो मतलब वो जो फैक्टर है वो हॉस्पिटल फाइनल टारगेट को इन्फ्लुएंस कर रहे हैं। और फिर सिग्निफिकेंट लेवल देखना पड़ेगा कि जो रिजल्ट आपने निकाले वो सिग्निफिकेंट है या नहीं। तो 2 चीजें देखनी है। तो जो गो टू जो लोअर पार्ट है उसके जो फर्स्ट 3 4 वो है। हाँ, आप हाँ थोड़ा लेफ्ट आओ। हाँ ऊपर जाओ। हाँ और ऊपर जाओ। हाँ बस और थोड़ा ऊपर जाओ। अब देखिए, आप थोड़ा सा नीचे चले जाओ, वो रेड आ रहा है उसके आगे। हाँ, तो इसमें सारे स्क्वायर लाइन के यानी कि वर्ग के लेफ्ट साइड में है। इसका मतलब जो भी वो इन्फ्लुएंशिंग फैक्टर है वो फाइनल टारगेट को इन्फ्लुएंस नहीं कर रहे हैं और ये रिजल्ट सिग्निफिकेंट है। तो जो आपने अगर किसी पेशेंट में मिथाइल फेनिलेट और एंटीसाइकोटिक साथ में चली, लेकिन वो क्योंकि स्क्वायर लेफ्ट साइड में है तो फाइनल हॉस्पिटल एडमिशन को इस इकट्ठे कॉम्बिनेशन ने अफेक्ट नहीं किया। और रिजल्ट भी आपको सिग्निफिकेंट है, लेस देन 0.001% बताया है। और एक में 0.002 से कम है पी वैल्यू। तो मतलब ये रिजल्ट जो निकले हैं कि वो स्क्वायर आपका लेफ्ट साइड में आया वन के, मतलब कि इकट्ठे यूज में इन दोनों के इकट्ठे यूज को हॉस्पिटल एडमिशन को अफेक्ट नहीं किया। ये रिजल्ट निकला और ये सिग्निफिकेंट भी है। ये इनका फाइनल कंक्लूजन है। तो आप बाकी फैक्टर्स भी देख सकते हो। मान लो कि पर्सनैलिटी डिसऑर्डर है जैसे, तो पर्सनैलिटी डिसऑर्डर ने हॉस्पिटल एडमिशन को एक्चुअली ऑलमोस्ट अफेक्ट किया है, स्क्वायर वन पे है। और वो रिजल्ट सिग्निफिकेंट नहीं है, ऊपर वाला नहीं का नीचे। प्रायर एडमिशन फॉर साइकोसिस में देखिए, प्रायर एडमिशन ऑफ साइकोसिस ने बाद में हॉस्पिटल एडमिशन को अफेक्ट किया है इस पॉपुलेशन कोहॉर्ट में, और वो रिजल्ट भी सिग्निफिकेंट है। ठीक है, या फिर आप और देख लो कोई फैक्टर, अगर सेक्स देख लो कि फीमेल सेक्स पॉजिटिव फैक्टर कम हो सकता है नहीं करने हम करेंगे। ये क्या है सब सब्सटेंस डिसऑर्डर है, ऊपर में क्या कोमोबिलिटी है। ये 0.02 है जिसका फैक्टर की वैल्यू। ये कोमोबिलिटी था या सब्सटेंस एसिड है? कोमोबिलिटी है। कोमोबिलिटी क्या नहीं देखिए मैंने भाई, मुझे सब देखा देखा। हाँ, तो अगर ये है ऑलरेडी कोमोबिलिटी है तो हॉस्पिटल एडमिशन फॉर साइकोसिस के इस पीरियड में चांस है। और रिजल्ट सिग्निफिकेंट है तो 0.05 से कम है वैल्यू। ठीक है, तो उन्होंने कंक्लूड किया ना, तो नीचे वाली टेबल थी जो ऊपर वाले 3 4 पॉइंट्स है वही कंक्लूड किया, बाकी सबका रिजल्ट कहीं ना कहीं कंक्लूड किया होगा, आर्टिकल देखेंगे। ठीक है, चले आगे।
Now, the post-hoc analysis, overall, 7,802 participants were paired to form the comparison group. The participants initiated or an ADHD medication. They appear to have a more complex clinical profile than the comparison group. Substance use disorders and personality disorders, they were more prevalent in the study cohort than in the comparison group, as was the use as was the use of psychotropic medications other than antipsychotics. The proportion of hospital admissions for psychosis in the year before the index date was similar in both groups. In contrast, the psychostimulants or the tamoxifen group had higher rates of admission in the previous year for other mental and non-mental disorders than the comparison. Now the discussion. Now psychostimulants and atomoxetine, they are when used in combination with antipsychotics, decrease the rates of hospital admission for psychosis and for mental disorders other than psychosis in the year after the initiation compared with the previous year, both graphically and statistically. A study which was done by Hollis et al. Also found evidence supporting a protective association of methylphenidate used in psychosis in the population. Although a majority of participants received methylphenidate, the results do not suggest that amphetamines are less safe than methylphenidate in terms of hospital admission for psychosis. Now, adequate treatment for ADHD could also increase medication adherence in individuals with schizophrenia spectrum and other psychotic disorders, as it improves neurocognitive impairments that negatively affect adherence. It may also be that psychostimulants and atomoxetine do not significantly interfere with the pharmacodynamics of the co-prescribed antipsychotics. Now, although limited, there is evidence that administration of psychostimulants at therapeutic doses does not increase dopamine transmission in the mesolimbic pathway, and they may even decrease phasic dopamine release while tuning up tonic liberation, thereby producing attention-enhancing effects without causing psychotic symptoms. Sir, article will the references, please. Yes, sir. So the study was also mentioned. So, what is it? Now, the strengths of the study. This is the first North American observational study and the largest to date to examine the risk of psychosis associated with ADHD medication use, specifically in individuals with schizophrenia spectrum and other psychotic disorders. The use of an extensive health database, which includes the majority of people with psychotic disorders in the province of Quebec, Canada, provides a representative picture of the real-world clinical practice. Now, the database used also provides extensive information on potential confounding variables such as psychosis duration, socioeconomic status, psychiatric and physical comorbidities, as well as history of hospital admission, which could be taken into account in the statistical analysis to limit a potential confusion bias. Additionally, the lack of effect of ADHD medication use on an unrelated outcome, that is hospital admission for non-mental disorders, it provides more confidence in the main results obtained. The comparison of individuals prescribed psychostimulants or tamoxifen with a control group also showed that results obtained were not entirely due to a possible selection bias. In addition, the study also brings forth novel data on the usage of amphetamines and atomoxetine in individuals with schizophrenia spectrum and other psychotic disorders. And the one-year follow-up period following ADHD medication initiation also supports the persistence over time of the observed results. Now, the limitations of the study. The information about specific therapeutic indication for psychostimulant or tamoxifen treatment was not available. The data on ADHD medication use, it excluded the period when participants were hospital inpatients, and the study design also did not allow to capture the mean or maximum dose of psychostimulants or tamoxifen used, and it was also not possible to assess whether the results obtained might be secondary to an increased intensity of clinical follow-up after initiation compared with controls. Now, the critical appraisal, the title, it clearly defines the topic they want to study and the study population. However, the study design is not mentioned. Topic, it is useful because ADHD, as you mentioned earlier, is associated with a worse course of schizophrenia spectrum and other psychotic disorders, including earlier onset, lower academic, social, and occupational functioning, as well as poorer response to treatment. An appropriate treatment of comorbid ADHD with psychostimulants may promote recovery of psychosis in such patients. The authors, the name of authors are clearly mentioned. The abstract is concise and comprehensive, easy to follow up, and information in the abstract matches with the whole text of the article. Now, methodology, the study design is clearly mentioned. Confidentiality has been maintained. The result was presented in a logical and comprehensive manner using tables and charts, and the data given in the text and table, they match with each other. And the discussion of the article is meaningful and tells the important findings of the study.